When you go in and you request a service from whoever the medical provider is, I would like to not think cynically that they want to bill to the maximum amount that they can bill you. But in your gut, that's what you're thinking.
In 2012, I started having issues with my hip. So I ended up reaching out to an orthopedic doctor that was recommended to me. There was indeed a labral tear. So he actually ended up doing bone tacks and femoroplasty, which is where they reshape your femoral neck and the ball of your femur.
Jason was diagnosed with cancer on March 3rd, and we were told very quickly that he needed to go in to have surgery as we didn't know what stage it was. Thankfully, within about 4 days, we were told that he was cancer-free, that the surgery had taken care of everything. It was stage 1 and hadn't spread anywhere.
So when you get a bill, it was confusing to me initially, and it kind of still is, but I get it now. If I had that opportunity to have a simplified version of healthcare billing, it would just make the world such a better place. I feel like everyone would be happy. You wouldn't have to pull your hair out to pay your bills.
Within about a month after the surgery, we were pretty much inundated with every single bill that was going to be a part of his recovery, and it was a lot. And we felt at the time, I think we were saying, I wish there was something that can make this easier, because this is just too much. It's overwhelming, and the bills did just keep coming and coming.
I mean, where else do you walk in for a service and don't have a clue about what you're going to pay for, how much it is, whether you really need it or not? It's an anomaly. And I think that when we get to standardized costing, when we get to transparency billing, then you will build trust, and then you will have, I think, a robust system. In a nutshell, I think that if we're going to endure this new medical way of living, that 1, you have to be your own advocate. 2, you have to have a solid billing program to where the layman person understands it and says, yep, this is what I expected, and this is what I'm going to pay.
You know, going through all this, I never thought I was going to get to have a baby. When I first received my billing for Blair's birth, to be quite honest, I was confused. I even had my husband look, 'cause I'm like, why am I getting a bill from Blue Cross Blue Shield? And then once I did and read a little more closely, I realized that that was my bill. And then it had been simplified.
I didn't become aware that UDA was a part of the Blue Cross Blue Shield billing until I actually had an injury. I fell and completely shattered and dislocated my ankle. About a month after I had my surgery, I got the statement in the mail, and I was just over the moon with how different my experience was versus what we had to deal with Jason.
I think if UDA Health could come in and provide clarity to the service that was provided and put an end to the string billing, that would be a great service to a lot of patients that have received care.
I just want more companies to think along those lines, that families need help. They don't want to be bankrupted by something like this happening, and partnering with a company like UDA, make it very simple to streamline repayment so that providers are getting the money that they deserve, and that families can, focus on what's important, and that's healing and moving forward with their lives beyond an incident.
UDA Health just makes it easy. It's all in one place. It takes out the guessing. It takes out the legwork. There's so much legwork that has to go into properly paying your medical bills if you don't want to overpay. I would use UDA Health over anything. If I was searching for a provider, UDA Health, if I saw that name, I would just know that would be a huge factor in deciding who I would go with, what provider I would choose. It's all consolidated into one happy little piece of paper.